Welcome to the Healthcare PMO podcast. It's a pleasure to have you here today to learn a little more about this great industry. My name is Americo Pinto. I'm the PMOGA chair and founder. Today we have three very special people with us. The first one is Asiya. She is the chair of our PMOGA group, strategic group. It's a new initiative. We also have Mr. Khalid. We also have Veronica. They will have a chance to tell you a little more about them to you, so you see, how they well represent this great industry, and we will have a conversation about the healthcare industry, how it connects to our life of PMOs and project managers, and I'm sure that we'll have great minutes of strong knowledge and a great experience sharing opportunity. So, Asiya, please.
Thank you, Americo. I've recently joined PMOGA Alliance community. It's been a pleasure. Thank you, Americo, for having me with you and with your community. Let me introduce myself. I work at King Faisal Specialist Hospital and Research Center in the Jeddah branch as health informatics specialist. I've been working in the healthcare industry for 13 years. It has sort of become my passion. And yeah, I'd love to hear from Dr. Khalid and Veronica. Why don't you go ahead, Veronica?
Well, thank you. First of all, I want to thank you both for, this invitation to kind of be on the panel today to talk about my experiences in healthcare. I am the chief nurse for Cerner Middle East and Africa. My background, I'm a pediatric nurse by background. I've been probably in the medical field for as long as I can remember. I started out in high school, looking at medicine. How do I interact with patient care? I'm a veteran as well. I was in the Navy for 25 years and retired. And while I was in the Navy, I was in the medical corps as well. So as you can see, my medical background has spanned it from high school to military and to where I am today as the chief nurse for Cerner Middle East in Africa. So thank you again for having me today.
Dr. Khalid?
Good morning, everyone, and thanks for having me. It's such a beautiful day and a great pleasure to be here. My name is Khalid Alodhaibi, and I work as a group CIO. We have a group of 26 hospitals and 160 VHCs. And we're going through a massive transformation for that group. It's about 10,000 beds facility and distributed, as I said, across 26 hospitals. So it's been, yes, and I'm going to disclose the number. It's been over 20 years in healthcare IT. So it's been a while. I started as a hardcore technical person working in systems, carrying CDs and doing installations here and there. So, and I spent about a couple of years doing this. I was very fortunate. I worked in King Faisal Hospital in Riyadh for about 10 years. We did a massive transformation. Then I migrated to the US and the Silicon Valley. I joined a couple of high-tech companies, and I spent a wonderful, beautiful 13 years in the US, and I moved back like a few years ago to Saudi. Most of my time was in IT, but most of it was in healthcare. So it's my pleasure to be here.
Very good, very good. All right, Asiya, can I start with a question?
Yes, sure.
I can't, wait for that. Actually, Dr. Khalid, I would like to ask you a question. We know that IT, is part of any company, any industry, but I understand that it has a very special role in healthcare industry. So how do you see that IT is important and it's different when we apply, technology in healthcare industry to other industries? So what is the role of IT in the healthcare industry? How do you see that?
Uh, it's a great question. It's very important, yet it's very tough, honestly. And I've been into different industries, like finance, like education. But once it comes to healthcare, it's very very complex system.
Mm.
I'm not talking about the IT system of it, but the administrative piece where the patient is the center of this puzzle. So in IT, doing a transformation for something that's less risk is much better for us. But once when we tap into something that involves people lives, we tend to be very cautious, and that's natural feeling, because imagine yourself being a patient and some high-tech guru comes in to introduce a new technology that has not been tested or validated and verified, and something wrong happens. You wouldn't like it. So it's healthcare in IT also, another inhibitor is very expensive. So it's not easy to be selling the idea of IT transformation in a very diverse and complex system like healthcare, because the bill is going to be big, and again the risk is high. So it has every element where people do not want to do any piece of it. But hey, if you don't do it, your problem will be much more complicated than you could imagine. So it's very good question, but I hope that I addressed it the right way.
Yes, yes, perfect. Asia.
Talking about IT and healthcare, I mean, with the latest technologies that we see now, we see artificial intelligence, we hear about blockchain, we hear about Bitcoin, and we also hear that, all these technologies will soon be incorporated into
Oops.
healthcare. My question to be, how do you see artificial intelligence being incorporated in healthcare, and what would be the pros and cons of having artificial intelligence in healthcare? I mean, either one. Sorry.
I'll start off just a little bit. I think that artificial intelligence is the new future. I think that in order for us to kind of see the different changes and the impact to patient care, we must move in this way. I think that we're already doing a little bit of that. It's not to the level where we're where we want to be. I think if we just talk on a very simple level of basic intelligence, artificial intelligence is the nurse at the bedside that has all of the different equipment that she looks at, the monitor that tells her what the heart rate is for the patient, or the infusion pump that has the patient medication that sits in that. She's looking at all of that data, and there are alarms that come to her that says your patient is in danger at this point, and there's a point of entry for clinical data that you need to take a look at. So that's happening on a very small scale. I think in the future, there will be more of a emphasis on how are we connected to our devices. I think every one of us has a phone, an iPhone. If we're not there already, it's certainly coming. We're moving to iWatches, devices that help us with testing glucose monitoring at home for patients. All of that information at the bedside or at home for patients, being able to then feed that back into the clinical record so that someone is monitoring me at home and being able to see that data. I think this is going to help us get to a place where we're looking at, we can predict, how a patient's glucose is going to go up or down, on any given day, how to adjust medications. I think that some of the cons with that is just that we don't know enough. We don't know enough
Yes.
about it. How do we secure data? What do we, are there any policies and laws around, utilizing that data? And then to just not to go so far with artificial intelligence that we think that it takes away from the human touch. We always have to have clinicians that are involved in that so that we are actually touching the patient and making a difference, and then being able to analyze that data in order to talk about increased outcomes and how we impact, communities as a whole.
Very good, very good. So, Veronica, I'd like to ask you a question, right? Actually, I've been thinking about that, about healthcare area. I told you I'm not a healthcare person, actually. I have some experience in the area, but I don't work specifically in the industry. But I see that there are many challenges, actually, for this specific sector. We know that healthcare is something important for everyone, everywhere,
Mhm.
any region, right? And we also know that it's something more accessible for some people, for some regions, So it depends on money. That's the truth, right?
Yes.
And the future of this sector is something that really make me think about. I live in Brazil, and Brazil is a big country, right? But we still have many problems and many people, right, that need healthcare, right, in many different
Mhm.
ways, and sometimes they don't have access to it. So how do you see the future of healthcare, especially in terms, not only in terms of its evolution, because it has been evolving all the time,
Mhm.
but how it will evolve in terms of becoming more accessible for people everywhere, So how all this evolution can make healthcare and the technology, I believe that it can help, but how we can make healthcare more accessible for everyone, and even those people, those regions, those countries that can't have all the benefits, because sometimes there is just a lack of money
Yeah.
to get there. So how do you see that? What is your vision about that?
I,
That's
um,
very
I,
good.
yeah. Go ahead. I'm sorry.
No, I was just saying that's a very good question. Like, how can we approach those areas, those
Mhm.
communities that do not have easy access to healthcare?
uh,
Yeah, I think we're seeing a little bit of that today. I think when COVID happened, I think we really had to look at how we're doing business within the walls of the hospital today. Some of that is changing already with telemedicine.
Correct.
I see it changing with the implementation of virtual visits. There's so many companies now that are offering, patients the ability to be seen and advised by providers through your telephone. Being able to connect with a provider to give you feedback on whether it's a mental health issue, or whether it's a simple issue that you might have. I think where we will see some more changes in the future is where we start to look at smaller hospitals becoming a community, together, where they're setting up in rural areas and being able to touch more individuals. We might see, where there are um, the possibility of mobile units. They do that today, where you have mobile units that go out to see patients for dental exams.
yeah.
Cancer screenings. We're doing a little bit of that in Qatar today, where you have a mobile unit that's doing some of that screening. So I think that's where you'll be able to kind of meet some of the individuals in those rural areas, and where you have community of hospitals that will come together. Might have a specialty here for cardiac, or another community hospital to take on specialties. So I think we will have to take advantage of telemedicine, virtual visits, mobile units in order to kind of reach the masses. And then maybe kind of restructuring, healthcare to say, do I have a kind of a command center that kind of has ideas about what's happening in the community? Are there dashboards that can tell me, information about my community or my, span of a city or a region to kind of give me information on those individuals. So I do see it going that way. I think we're a little bit there already just because of COVID. I think it pushed us to move a little faster than we have in the past. And so those are some of the things I see us kind of moving to as the future of hospitals, really going outside of the walls that you see today and kind of moving into the community.
It's a challenge. Very, very, very good.
Absolutely.
Very good. Yeah.
And to add to that, Americo and Dr. Khalid, we at King Faisal have already started virtual consultations. So we are starting to see patients virtually than having them to come physically to the hospital. We are also starting to, give them, we deliver medications to their home. So we do have DHL services as well. So, yeah.
I think it's a change for them, right? I think that kind of it's a change to get individuals to kind of move away from that.
Yeah, and I'm sorry, and Dr. Khalid, technology is something absolutely important, right? To make all of this happen, right? To let people have access to all these great things that have been created in the industry, all these advancements. So how do you see that? Because when we talk about IT, I understand that we have IT in terms of developing our organizations, our hospitals, so we are talking about that internally, so we are becoming more efficient, right, as a healthcare company. But when we talk about healthcare as something, broader, how do you see that technology is becoming something that can make a difference, to let people have access to all these benefits and all this evolution that we can see today? That's the point.
Sure. It's a great question, Americo. I don't think the problem that we're having right now worldwide is technical. I really think it goes back to what we just mentioned a while ago. Healthcare is a very complex system. I can in no time create a remote access telemedicine facility and expect that this will create a remote hospital where people can come and everyone is safe and happy. But that's not the case, and it's not happening. And again, we could, from a technical perspective, we could create this with a very minimum price. So I don't think the problem is technical. It's again, you're tapping into a very big, fat, complicated system where you're trying to do automation for. And unfortunately, people think it's easy, and you just need a monitor and a microphone and have a physician on one side and put a pile of patients on the other side, and this is it. This has not worked. I don't think it's going to work that easy. There is a lot of work that needs to be done. Again, and if you ask me why this is happening, I could speculate the answer as the following. We're not putting or creating a patient-centric business models. The minute you do not pay full attention to this, this is when your projects will not scale and grow easily. What I mean by this, if you do not have the patient as the true inventor of how they're going to be served in a telemedicine fashion, let's say, because I'm using this example, than thinking from administrative or a clinical perspective only without having the patient as part of this puzzle will make your project not succeed. And that's what's happening right now. Telemedicine, it should have been done perfectly probably 20 years ago, and it's not happening. And this is true in rich countries, in poor countries, in countries in between. So again, I want to go to the basics, have the patient be the center of this, and create your business model or service model, I should call it, because we're not generating business or making a business. It's a service that we're desperate for. So that would be my thought on this.
And Dr. Khalid, can I add to that? I think you're right. When we take away the choice, or the exclude, the not including the customer who is the patient, then we lose sight of where we're really trying to get to. Included in that is really thinking that, as you kind of stated, is that technical. This is not generally all of that we want to do from a healthcare perspective is really not an IT. It's not shouldn't be an IT project. Yeah. It should be a clinical project, because we're dealing with, clinicians, we're dealing with the patient, we're dealing with their families. And when we put them, first in those decisions, from design to, implementation to communication, then we hit the mark. But as soon as we take away those components, I think those are three, key components, we kind of lose sight of what really is the purpose and the why for doing some of these things.
Yeah.
Yes.
It reminds me a very, very interesting discussion. Actually, I don't know if it makes sense for you, but let me share some thoughts with you. I've been teaching at MBA courses for more than 2 decades. And there was an interesting discussion in some of these institutions where I teach, that is, if there is a difference between the concept of a customer and a student, So is a student a customer? You know what I'm saying? Because there are some slight but important differences if I treat my student just as a customer or the opposite. You know what I'm saying? And maybe when we think about a patient and a customer, I know that it looks the same thing, but maybe there are some differences too, because the interests of, if we see our patients just as customers, I don't know what would be the impact of that. I can see that in the educational area, So if I just see my students as customers, maybe it will not work very well, because sometimes I need to focus on them as they are, as what they are. They are students, and sometimes as students, they don't know exactly, what they need. And if I say, for example, oh, you are my customer, they can say, oh, I'm not satisfied because I would like something. You know what I'm saying? And
Right.
no, first you are a student, so you have to follow this because we understand what's better for you as a student. You know what I'm saying? So I don't know if it makes sense for the healthcare area, but actually for me, a patient and a customer, they have many things in common, but there are some slight differences. Maybe does it make sense, or I'm just wondering.
For me, it makes sense, right? I'm a consumer, right? And I think, patient care may be going there, one day. I think about the example of just my mother. She's 70, she's in her 70s, and was getting ready to have hip surgery last year. And I think my brother and I immediately became consumers, in the sense of, today, if there's something that I want to make sure I'm getting the best of, I start to look at the different sites. I love to shop. I don't know if I'm by myself, but I start to look at shops and shopping to say, where can I get this deal or the best? in a particular area. And we looked at that for my mom. Like I'm a consumer who wants the best for my mother, even though it's associated to healthcare.
Exactly.
So I started to do research. My brother was doing research, who's an engineer, and we wanted to know about what are the outcomes at this hospital. What were the ratings for this provider? Do you have what facilities and things of that nature. So I think at a point we are consumers to a degree, because we're trying to look for an area where we can get the best outcomes, and we're following up and checking. I think more patients are starting to do that. They want the best doctors, they want the best hospitals, they want the best outcomes.
Yeah.
And I think that's certainly where we're going to. And I think that's where hospitals will start to kind of think about, are they putting things in place that make sure they have the best outcomes to lower costs, and change the experience
And
for them.
quality care.
Yeah.
Absolutely.
Yeah. Yeah.
Yeah.
Absolutely.
Yeah,
I
and
mean, I mean
there
now.
is a collective responsibility too, right? Because sometimes you can't see, I believe that you can't see all of this just as one person, but actually there is some collective responsibility that is connected with public policies, for example, right? So
Mhm.
everything is connected in some way. It's not like, oh, I'm selling a new TV for you. No, uh,
Right.
it's much more complex, right? I believe.
Right.
Yeah. And Dr. Khalid talks about that complexity, that healthcare is a complex business, of taking care of patients in all the different areas that intersect on that one patient when they come into a facility.
Yeah, sure.
I mean, talking about patient care with technology and everything. I know. I mean, before I did have a question in mind, like when you were speaking about your mother. I mean, that's a very good personal, something very personal to share. Nowadays we even have, because everything is all online now. So nowadays, we've got physician profiles online, and then you've got their ratings as well. So talk about that consumerism. There is sort of like a competition as well between physicians. So when we as consumers want to look or search for the best physician for ourselves, we do see who's got the best reviews and
Mhm.
which hospital we want to go to. Um, with that being said, that has IT also helped with chronic disease care or chronic disease treatments? Um, since Veronica and Dr. Khalid, you guys have been in this industry far longer than I have. And Veronica, you mentioned about your background. You started off with Navy and then med school. And then now that you're here, looking over these years, Dr. Khalid, for you as yourself, you worked at King Faisal Business Hospital, and then you went to Silicon Valley in the US. You've worked in several different industries. So asking both of you these questions, like from where we were to where we are now, do you think technology has helped with the treatment of chronic disease or not? Do you see a progress there?
Sure. Uh, uh, I'll have a say on this. It's The answer is yes, and the quick answer is yes. Think of clinical registries. Clinical registry is nothing but building intelligence. It's not that advanced, but again, you're collecting basic information for patients, especially in chronic cases like diabetics, breast cancer, and you name it. So the collection itself is there, the data is there, but how much gain did we get out of this? I'm very careful to say it's impressive. It's not impressive, and again, this being collected probably in the idea of registries started in the mid 80s, and but still we're not getting a very huge and benefit and value out of it. I'm hoping that we will very soon. In my view, it's a computing limitation issues that used to be there. Now it's not there. So you would assume that big, large companies like IBM, Google, and you name it will have these powerful algorithms that you will apply them on this big data, and we will get a huge value out of it. Is it happening now? No, it's not. I'm very comfortable to say this because again, that I was in the heart of these big companies, and I knew that it's either they don't have access to the data, and if they do have access to the data, they don't have the domain expertise and knowledge where they can create these algorithms. So it's and even if they do, it's very hard to make and draw a conclusion because no one will be taking this for granted. So again, it's not easy. With time, I'm hoping that we will get there, and I'm very optimistic.
Yeah, I would agree with that, Dr. Khalid. I think we're not there. I think we are making, incremental, changes to get there. I think it just, as you stated, when we talk about, chronic disease management, it takes an integrated approach. It's not one size fits all. I think it takes on multiple aspects in order to kind of manage that. And data is just one part of that. I think do we look to include other aspects of that, of like, care coordination, to kind of help, coordinate the care for the patient? Is it sending out reminders about medication for your diabetes or for heart disease, and working with pharmacists and things of that nature as this kind of integrated approach in teams in order to kind of see some of those changes? We have a long way to go. I think when we start to include things like data, though, and trying to use that as predictive, analytics, I think we'll get there. But I think yes, you're right. We have a lot of work to do in that area, for the future.
Yeah, I agree. I mean, we're a little behind with the data, with gathering data and with the research as well.
Yeah, very nice. Dr. Khalid, let me ask you my last question, because we are close to the end. It's a shame, I could spend all day long here with you. But now I'd like to ask you a question that it's more related to my field, actually, project management, right? I've been working as a consultant for more than 20 years in project management strategy, and I've already had some clients in the healthcare industry. I know that each industry is different in many aspects, of course, but talking about project management, we know that they are different also in terms of maturity. I'm talking about executives, and one specific thing that I felt when I had an opportunity to work with hospitals, for example, it's the fact that we are dealing with a different type of mind. We are talking about physicians, doctors. We are not talking about engineers, and IT people. It's another mindset. It's another mindset. I'm sure that you can understand what I'm saying. So, how do you see that? Is it a challenge in any way? Because we have to make our projects happen, right? So we have to manage them. We have to plan. We have to control all our initiatives to ensure that they will get the results. And so, how this characteristic of the sector, that we have people with a specific background, not very technical, so they are not project managers by nature, right? So how do you see that? How does it impact, an IT area, for example, the one that you are leading today?
Sure. So, first of all, Americo, you look 18 to me, so I'm surprised that you do have 20 years of experience. So
Yeah,
that's
yes,
quite
yes.
better.
It's the Brazilian. It's the Brazilian weather. You know.
Yeah. So dealing with the healthcare providers is not easy, and it's very amazing how I could not get away from them, and I'm in love with their environment. So if you, in order for you to succeed in healthcare from a PMO perspective, is to understand that you are dealing with the brightest minds. They're let it be nursing or pharmacist or radiologist or physicians or lab. So truly, you're dealing with a very interesting and challenging mix of talents. You walking into them as an IT and trying to dominate and trying to have control is not something that's going to succeed unless you do it the right way. In my view, little input that I have is make them feel that this is their project and you're doing what you're doing for them. They turn into a very nice beasts if you start dealing with them this way. I have seen very major disasters because the IT thought that they will do the change by themselves. And I have seen very successful projects where the business owner continue to be the business owner, and the IT is the enabler for this. Yes, some people might say no, IT is more enabler these days. They are the transformation agent. Still, even if you are the transformation agent, you will have to include all stakeholders, and they have to be the business owner of this. Uh, if you do, it will be very impressive in terms of success. And I was fortunate because the domain that I work in right now is one of the toughest because it has a very diverse mix, which is military, add to it healthcare. So this is the toughest that you can be in. Yet, I believe that we did a very successful transformation over the last 3 years, and it was not because of the technology itself. It was because uh, all stakeholders felt from day one that they are the owner of this, that they have a huge say into how they're going to transform, and and I took the back seat, and it feels so good that they are the one managing, and yes, I am in the background, but I am I would say, I wouldn't say controlling, but I am fully aware of what's happening in terms of process and project activities. But they are also part of this. So this is how we combine the two team into one, and project management becomes very easy in this situation. But if you try to apply classical PMP theories into a healthcare,
Yeah.
Doesn't work.
good luck. It's not
Looking
going to
for
happen.
trouble.
No,
There's a lot
Yeah.
of
it doesn't
trouble
work.
there.
I know how challenging it is. Very good. I agree. Absolutely. Very
Mm,
good.
yeah. Just to add to that, I think if you just, remember the why, that is happening, and who is the ultimate individuals that you're touching. We're talking healthcare. So sitting, as Dr. Khalid mentioned earlier, sitting at the starting point of that is the patient and their families. And when you keep that in mind, making sure that, the decisions and the process that you're doing ensures that there's safety, that you can, you're putting the best solutions forward. And then, as Dr. Khalid stated, that stakeholders are engaged and they feel like they have ownership and they have a part in this, and I think you can be successful in that. But really keeping the patient at the center is something I'd like to add as well.
Very
Yeah, that's
good.
true.
Asiya, so would you like to ask your ending question?
No, I guess I mean, I don't have any more questions to ask right now. I guess we
Very
can
good.
conclude.
Very good. So, uh, thank you very much, Dr. Khalid, Veronica, Asiya, also my partner here as a
Yeah.
co-host. So I'm really happy with with this opportunity that we had to learn more about your experience. Uh, I believe that for all our audience that is composed by project management people, as I said, it gives us a great opportunity to understand a little more, a broader perspective about the industry, and it will help us to to be more, to focus on what really matters. That's the point, so we can have some vision uh, about where we want to be, right, in terms of objectives and future. So thank you very much. Congratulations. Thank you for Cerner, to support this
Yeah.
initiative. And thank you, Dr. Khalid, and congratulations for the great work that you have been doing at your organizations. PMO Global Alliance will be always available to support you in anything that you can need from us, right? So thank you, and for all our audience, right? For you that is with us today, watching this video, thank you very much. If you have any questions, send a message to us. You can find all of us at LinkedIn, and it will be a pleasure to support all of you and collaborate in every point that is possible. So thank you. See you soon.
All right.
Thank
Thank you.
you.
Thank you,
Thank you for the opportunity. Have a
Thank
great
you.
one.
Bye.
everybody. Bye.